Welcome very much.
That's a nice start for my talk here. But I will tell you a very special story about Austria, the pandemic, a private matter. And I would like to focus on the COVID-19 vaccine mandate in Austria, which is not existing to start with the end. I would like to start with history. There is a very famous hero of the past. His name is Andreas Hofer. He was Tyrolean, and he lived at the turn of the 18th to the 19th century. And he was, nobody knew it so exactly of the people in the country until now, but he was becoming a hero because of the first vaccine mandate on the world of Bavaria. At that time, Bavaria was the owner or was reigning over Tyrol, and when they started having their vaccine mandate against smallpox in 1807, the Tyroleans gathered together with their riflemen and fought against the French and against the Bavarians. And so Andreas Hofer, who was executed then, became a superhero. And somehow this is unfortunately still present genetically, or I don't know how, in the population. So let's speak about the discussion regarding vaccination against infectious diseases in the Austrian Bioethics Committee, because that laid the ground for the COVID-19 pandemic. The Austrian Bioethics Commission was established 2001. Currently, we are 24 members of various disciplines, not remunerated, and there are 38 recommendations or documents since 2001, and 13 of those alone since March 2020 regarding COVID-19. More or less also to similar topics like you here in Sweden when I remember the presentation of Lotta. And we are also doing many other things like public lectures, discussion, and so on. And in the year 2014, at a time where usually people from the bioethics field said, vaccination, that's not a subject for bioethics. That's maybe public health, but not bioethics. But sooner or later, all the various committees throughout Europe and also elsewhere were discussing this situation. And at that time, it was mainly measles, which was the reason for discussing it. I want to cut this short. We had a request of the Federal Minister of Health at that time, and what we decided on was that there should be an obligation for health workers to be vaccinated against measles. And nothing happened, there was no law, nothing, nobody took that up. And in May 2019, the situation with the measles became so bad in the country again that we discussed it, and we issued an ad hoc recommendation that not only health workers should be obliged to be vaccinated, but everyone. And that we really would have to rediscuss it also regarding other diseases like polio, pertussis especially. Well, nothing happened because in May 2019, the then government broke down with this awful case called Ibiza because of this video where you have seen part of the right-wing coalition party discussing about how to sell best the country. So nothing happened, and then nobody talked about vaccination anymore, and only in November 2020, our first recommendation in regard to prioritization for the vaccine, because at that time, in November, we knew that the vaccine would be ready at the end of the year, but it would be scarce. So we were talking about who should be prioritized. And what we saw also was under the motto, help the helpers, that health workers should be among the first to get vaccinated. And if there is a prioritization for someone, there should also be, looking at it from the other side, a requirement to be vaccinated. But nothing happened. The government didn't agree with that, and nothing happened. And the problems were increasing. In the beginning, everybody wanted to be vaccinated, and there was a famous case of the mayors of small places who although they were not at risk, tried through their function to get among the first to be vaccinated, but then nothing happened. And the vaccination rate in the beginning, rather high, was getting less and less. So we had several discourses about it and several recommendations. And we were also taking part of the review with the vaccine mandate, to which I get now here. Those are the words in which we were recommending a vaccine mandate for health workers in 2015. And before I come back to that, I would like to show you what was the argument for us to make a recommendation for compulsory vaccination. And of course, this is from the fundamental rights here, the proportionality. The more harmless the intervention is for the individual, the more dangerous the disease for the health of the population, and the greater the overall benefit of compulsory vaccination, the rather the interference with the physical integrity of the individual seems justified. And this is also the argument with which one can also look at other diseases than which was at that time the measles. As we have also seen before, the pandemic gave us all, especially in committees like bioethics committees, a new role. The bioethical norms, which were usually just seen among clinical research and clinics, clinical medicine, extended to public health and to other issues. There was a very much increased interest of the media, which we were complying with because we have the mandate also to go into the public. There was a high output for us under difficult working conditions due to social distancing and lockdown, so we all learned to get good quality discussions in video conferences. And beyond that, there were also members in all sorts of other government-related task forces, in the vaccination group, in the task force against COVID, in the Supreme Advisory Committee for Health, and so on. So this is something, I think, which we all saw in the various countries. So what was the reason here for people in the health working group that we could make a requirement like the driver's license to drive a car, compulsory vaccination in order to work with vulnerable people? We said they are prioritized, and therefore there is an obligation, because people who go to the hospital are always in a certain way vulnerable, and they have a guarantee, they should have a guarantee that when they go to a hospital that they will not be infected with a preventable disease. So nothing helped. Our government was not really taking up our recommendations, and as I said, that the rates of, the ratio of getting vaccinated were getting lower and lower. We issued a two-paper document named A Pandemic is No Private Matter, where we said social cooperation and solidarity by the individual are needed to overcome the pandemic. Well, again, not much happened. Yeah, I think I'm a bit lost with my slides because I put them in the wrong order. What we said in any case for the vaccination is that the vaccine enables a basic immunization for a long-term effective fight against the pandemic, because when after half a year it was clear that the vaccine does not help against the infection, but it gives a certain degree of protection against severe diseases. So, yeah, now I come to the slide I wanted to show earlier. We had politicians and a government who was continuously emphasizing that there will be never, ever in this country a vaccine mandate law, against nothing, against not for any group, nothing. They said also for health workers, we would never intrude in the freedom for decisions and so on. But in November 19th, there was all of a sudden, under one of the past chancellors we had, an announcement of a mandate. In February, the majority approved in the parliament of a mandate law for residents, and 2 days later, this law became effective, and it was planned until February 2024, with fines up to euro 3,600 planned for refusal, and this repeating every 3 months. But the politics faced an incredible amount of hostility against the vaccine mandate, and all the people who were going to the streets every Saturday in Vienna, up to 40,000, 50,000, who were in favor of their freedom, and they saw the vaccination a completely intrusion in their freedom. So it was politically very difficult because there were several elections upcoming, and the government was very hesitant of after having announced it and done all the arguments why it should be necessary, they were very hesitant. And what happened was that in July 8, they repealed the law. At the same time, a new wave started in Austria. So if you look at the situation of today in Austria, we have a rate of about 56% of fully of people with a full basic immunization. We have only 71% who had 2 immunizations, and still the effective reproduction number in Austria is above 1. So we still are wearing more masks, but also the masks are very debated, and although the city of Vienna requires masks to wear in public transportation, you can find many people not doing it. And the problem, I think, is that also many of the convincing factors have not been transported the way it should be, because even the person in the government task force against Corona was the day the mask requirement was announced, was publicly giving interviews that he thinks that's stupid because they don't have any efficiency and so on. And you could always see when speaking about the vaccination in TV, an arm and a needle big up to this big, and only now we get more and more documents of things which were clear that seeing needles for people who have a phobia is not really good. And the other problem is that it's also not a complete surprise that the vaccine in hesitancy in Austria. It's also a question of trust and the government. So all of these things are a sad story, because now we have no vaccine obligation, neither for health workers, neither for measles or pertussis or other diseases, nor for against COVID. And I come to my take-home message. The recommendation already since 2014 of our committee was never implemented, nor the recommendations of the National Vaccination Board, which of course always also were in favor of mandatory vaccination for health workers. There's absolutely no legal obligation, but of course the institutions can ask for it. But this is difficult because we, as you also, have a shortage of healthcare personnel, and if one organization says they have to be vaccinated, then especially in nursing homes, they go to the next one. Causal for the political decisions were the opposition from right-wing political groups and conspiracy theories shown in regular large demonstration with the word freedom, protect our freedom. And the strangest was in February when there was a demonstration against the war in Ukraine. At the same time, a demonstration against the vaccine took place, and freedom was written on both demonstration panels. And of course, we all see a big difference between Ukraine and the freedom, which is really was in complete danger and is gone for them in comparison to a vaccine. So the vaccination issue became a completely political issue, and it blocked out everything. And the fear prevailed it would shape the results of all the upcoming state elections. So that is the end, and it's a sad story, and one can only learn from it to make it better. Thank you very much.
You know, we had a different strategy in Sweden, and do you think it will ever be possible within the European Union to begin with to have a joint vaccination strategy when it comes to pandemics, or will there be differences between the member states?
Well, I think one of the problems is that governments should be in a certain way opinion leaders. And if they are not daring to say that vaccination is one of the best things history and medicine has given us against measles, polio, smallpox, whatever, and they don't stand up and say this is important, but really go around, yes, maybe, but not if you don't want to, and so on. So this is bad, and maybe it would be better if there would be a specific strategy Europe-wide.
Common, yeah. Okay, thank you very much.
You're welcome, thank you.